out of my adult education background. So I helped design and do training. And then another thing was just, Mazen is looking at me with a smile, was just kind of taking on this role, which I loved, which was just being supportive to people who were diagnosed with cancer that I knew they were friends. And it wasn't that I gave them any medical information, just so you know that. I was never seen as that. I never have seen myself as someone that could actually give you any kind of sense of what kind of treatment, what is the best. That is not my role. My role was definitely an educator. But I would send them cards. I would send them letters. I would talk on the phone. I would send them little booklets. It's amazing what those kinds of things can do. In fact, I was amazed. It happened to me when I was in treatment. And what I found was that this was a way that was, again, a gift that you could give back. And interesting, treatment isn't over after the surgery. As all of you, I'm sure, are aware. And sometimes there's an outpouring as you're diagnosed and you begin the treatment. But treatment lasts for a while and can be very tough. And so one of the things about this kind of giving, this giving, is to provide support not just during when the treatment happens or maybe the first part of it, but to go all the way through with just nice little cards, telephone calls, visits if it's appropriate and the person would like that and you're close. But if you're not close, then as Prof. Naza knows, I love to send cards. It's one of my favorite things to do. And so I would send cards that would be encouragement and those kinds of things. Also, influencing the workplace. That to me was extremely important because, and I can't speak for Malaysia, I can only speak for the United States, but back in the 90s when I was diagnosed, the early 90s, there wasn't a sense of entitlement in terms of having disease. You had medical leave, which was very good medical leave, but somehow there was an expectation as a university professor that I was still going to do everything. Well, I'm sorry to keep looking at Mazna, Prof. Mazna, but that's not realistic. And so part of what I did was talk with people within the workplace and tell my own story about how people in the workplace can also support people who are going through this process of having cancer, again, no matter what kind. And the last thing is spreading awareness and educating the community. And part of that came from helping to design and bring forth additional support groups. Again, I would not be the person who would necessarily facilitate them, because we always had facilitators that had some kind of medical background. So the importance of giving back. The crossing of the international borders. This was an absolute, positive, unplanned surprise, in that a friend of mine, Prof. Mazna, was diagnosed with breast cancer, called another friend, Prof. Sharon, who said, talk to Prof. Rosemary, because she's the one that's been through it. And Prof. Mazna was hungry for information. And there was very little information that could be found either on the internet at that point, and there was really almost nothing in Bahasa. So that I sent Mazna, which was interesting even in the sending process in terms of an international project, is it took me 3 times to get these booklets into Malaysia in terms of what I called them, because it couldn't get past the customs. And finally I found someone who could help me do that. So even crossing international borders with simple things is not necessarily that easy. But it was something that I felt very, very strongly about, wanted to do, and what came out of that, and really what came out of that is 2 friends who sat down and were talking And Masna told me how she had gone to the hospital when she was waiting for treatment. And there's many times long hours that women sit or men sit in the hospital waiting to see doctors. And what she would do is she would bring the booklets from the American Cancer Society that I had sent her, and I had sent her, I think, 3 copies of each one. And for those that could read English, and it was pretty high-level English, she would pass those around. And for those that could not read English, she would just translate them verbally into Bahasa. So it's kind of her own education program, and she continues doing this today. Wherever she is in the hospital, she continues this process. And I don't want to single her out because I know she doesn't like that. But I have to, because it's an excellent example of someone who just said, there's a real need here. People would come in at that point, they would understand surgery, they would go through surgery, and then when it came to radiation or chemotherapy, they didn't necessarily understand why it made them sicker. And so if you're getting sicker, why do you want to go back for more treatment if you really don't understand the process? So that's how this project started. The Project CARE, with 2 definitely key things in this. One was to build a breast cancer program for and by Malaysians. We did not want this to be a copy of a program in the United States, because Malaysian culture is different than ours. And so it was very, very important. And actually the major players, except for myself in the process and a couple of other folks, were all from Malaysia, including I had a postdoc that worked with me at Cornell University for 3 years, who kept me on track. And that was really, really helpful. And also the importance of partnerships in building this particular project. And the partnerships, why they were so important is that the resources we had were very limited, which is not unusual for these types of programs. We're always fighting for resources. And so that Prof. Masna reached out to Ramallah, her sister, who was at that point president of the Malaysian Translation Society. Do I have that right, or is it backwards? Do I have that right, or is it backwards, Ramallah? Is it Translation Society of Malaysia? Association. Association. I knew I could get it close. Thank you. And what they did is something that was a miracle as far as I'm concerned. Translation is very difficult, especially since we were very much focused on doing culturally sensitive and language appropriate translations. In other words, direct translations do not work, because basically there's words in English that don't translate to Bahasa. There's ideas that are very important here that do not translate from what we have. And this was a difficult path because we used American Cancer Society materials, but this is where the cultural piece comes in so important in terms of support, in that they really weren't sure they could trust us, to be honest, to translate these materials in the way we wanted and get the right material translated, that we would change it too much. But after a while they began to trust us, and that's how this started in terms of, again, the material. But without the Malaysian Translation Association, which donated all of their time, their members donated their time to do the translation. And what it was, about a 2 to 3 year project per booklet, if I remember correctly, is that right? And so the translations are not easy to do. And as you'll see later, these have grown to now 31 different booklets. But again, that vital focus on education, which then supports people, because without education it's very, very difficult to think of what you're going to do and what's going to happen and why are you going through this treatment. And many of the physicians in the hospital are so overwhelmed with patients that it's difficult for them to do the kind of patient education that's needed. And one of the things that we hope is that the nurses will pick up much more of this. I know many of you already have, but it would be more of a centerpiece of what nurses do. And this came actually from Dr. Osmond yesterday, which was a phrase which was actually captured what we have been doing, which is the idea of from one book to a library. And that's really the way we started, with one book. And one book translated, and then two, and then three. And then we began gathering all these resources, which you'll see later as you take the tour of the Resource Center. So it's kind of like, how do you build a database, and that now will be both in print but also online, so that people again can have access, and also links to other places that they can get information. Again, one of the key parts is translating it into Bahasa, which is absolutely incredible. It, to me, is needed because language is something that's very important within all cultures. And I wanted to just give you some examples of support services. These are actually real pictures. The one down here, if you think we're actually nuts, we're actually not. This is one of the support groups. And we were doing dancing because this is something that support is not just talking about the bad. Support is also bringing forth the good in all of us. And one of the things that we know is that physical activity is something that's very important to people who are going through cancer treatment and afterwards. So dancing was a regular part of each of the support group meetings for CAN work. And it was a fun part also, though, as you can see, since I'm in the center, it's because I don't really know what I'm doing. I'm trying, but I'm not quite sure. This is an example of a continuing education program, similar to what you're going through today. This is just an example of an awareness program discussion, and you can see that we're talking about not just having women together, but also men to talk about cancer. And then there are many other services, from the Cancer Answer Line to counseling, to all of the online resources, to the portal in terms of information. So that what has happened is, over the years, we've responded to the needs. And unlike some other programs,